Okay, one of the arguments that the negative made against euthanasia is that they say that euthanasia will undermine the quality of palliative care. This is not true at all, because Barbara Combs, a president of Compassionate Choices, did on an interview at PBS News at Howard, said that palliative care has been the main beneficiary of the Organ Death with Dignity Act, which has legalized physician-assisted suicide. Since this passage, we've seen a great resurgence of interest in the medical community in palliative care. Hospice referrals have increased by 20%, and now organ euthanasia and prescription of morphine. This has had a salutary effect on end-of-life care. Also note that when people come into the hospital, they don't have to choose between palliative care or euthanasia. What ends up being the case is that patients will go through palliative care first. They will go through these end-of-life programs, and it's only after they decide that maybe these programs aren't effective anymore, that's when they decide to maybe go to euthanasia. They don't skip the whole palliative care and go straight to euthanasia. My opponent also talked about how euthanasia doesn't always supply a good death, about how maybe some patients maybe wake up or maybe they feel discomfort from their drugs or injections. The thing is that a good death has multiple meanings, not just the absence of pain. From an article by multiple physicians, Karen E. Steinhauser, Elizabeth Cliff, and Maya Magnetti, and the Search of a Good Death, they say that participants identified 6 major components of a good death: pain and symptom management, clear decision-making, preparation for death, completion, contributing to others, and affirmation of the whole person. So although pain is mentioned, that's only one small aspect of what constitutes a good death. Also, you have to consider the pain sort of relatively. If, let's say, you were just punched in the stomach, okay, that would probably hurt a lot, and you probably wouldn't feel very good about it. But if I was to also say that before you were punched in the stomach, you also been shot in the leg, you probably wouldn't care so much anymore about that punch in the stomach, because you're so focused on that pain in your leg. So in the case of a terminally ill patient, these discomforts that may arise from taking these drugs, they may pale in comparison to the pain and suffering that they're getting from the terminal illness itself. What these patients are doing is they're choosing the lesser of two evils, or the lesser of two pains. That's why they want to die in the first place. Because if the pain from their illness isn't such a big deal, then they probably wouldn't request euthanasia in the first place. Also, my opponent said that people request euthanasia for reasons other than pain. They mentioned things like feeling weak, tired, and loss of function. Those are things that actually already mentioned in my original pain when I said that patients don't request euthanasia for these reasons. They request it because of their quality of life. And these issues, they're feeling weak, they're feeling tired, loss of function, those things can affect a person's quality of life to a point where maybe they feel that, they're better off dying. And also my opponents mentioned that doctors, they're obligated, or they're not obligated to treat a patient due to religious beliefs. The thing is that patients also have the right to end their relationship with the doctor whenever they want. So even if the doctor refuses to euthanize them, the patient has the right to find another doctor who will perform the procedure. And since most of these opinions in favor of euthanasia actually do come from doctors, you can be certain that there are doctors who are willing to perform these procedures. So if they do request euthanasia, they will be able to find someone who will carry out the procedure.